Welcome to Beyond Bones and Muscles, a Legent Health podcast. Created by the team at Legent Health, a healthcare system devoted to helping you live life to the fullest. Your health, our priority. Each episode, Chief Operating Officer Daniel Brazel keeps your finger on the Legent pulse, going beyond the bones and muscles of Legent Health. We will discuss orthopedic and spine industry education and analysis, along with news from around the Legent healthcare system.
Hello everyone, my name is Daniel Brazel. I'm the President and Chief Operating Officer here at Legent Health, and I'd like to welcome everyone to another episode of Beyond Bones and Muscles, our podcast. Excited to have a conversation with some of our team members as well as you, the audience, about different trends that we're seeing in the short-stay surgical facilities, both surgery centers and surgical hospitals. And I'm joined today by four of our tremendous leaders, three of our regional vice presidents, and then also a new member to our team, our Vice President of Business Office, Sam Pennell. So I think some of you have met our regional vice presidents, but we have Stace, Pape, we've got Kathleen Beddingfield, and we have Brittani, Schmitz that are joining us. And then, as I mentioned before, we've got Sam also joining us. They've all got unique perspectives to their markets, but also sort of to the macro trends that we're seeing in this industry as well. So without further ado, we'll kind of jump in to talk about, again, some of the trends that we're seeing. But I want to start with Kathy, who leads our Houston market. Kathy, when we think about trends in the space that we're in, I also think about the things that keep us up at night, right? Because that kind of feeds off of the trends that we're seeing. So for yourself, Kathy, what are some of the things that keep you up at night, and kind of how are you navigating the sort of the ever-evolving space that we're in the short-stay surgical space?
Sure. So what keeps me up at night? Well, there's a lot that keeps me up at night. Running surgery centers and surgical hospitals is definitely a balancing act. People have choices. They don't necessarily have to come to you. So the main thing that I like to do in my centers is empower my leaders. We want to set a culture of safety, of customer service, and our customers are not just our patients, our physicians, our family members, our staff. So empowering our leaders to run their centers the way, we want to take care of our patients the way we would want our own families to be taken care of. At the same time that we want to give that quality of care, we want to ensure that we keep our physicians engaged, and physicians' time it's very valuable. We want to have quick turnover times, but we want to ensure that we're following all the regulations that we need to follow. So it is a balancing act between getting things done in a very timely manner, but doing it in a very safe manner. And so by allowing our leaders to be empowered to run their centers and to give them all the support that they need. Being in several places at the same time, there's not one of us that doesn't have more than one center. So it's important for us to give that support to our leaders, to let them feel empowered, and to build relationships and bonds with our physician partners to ensure that they have somewhere else to go if they need something through us. And we do all of this by leading by example, by giving our leaders the resources they need to do their jobs. Like I said, there's so many places that people have choices to go. And so they don't have to come to Legent, but we make it to where they want to choose Legent by having those environments. And I'll tell you, some of the most rewarding things that we get back, and one of them today was I just got a Google review on one of my hospitals, and the patient said it was like she gave us 10 out of 12, and the reason why is from the time she walked in the door until the time she left, she had absolutely amazing care. She had engagement from everyone involved, from the lady at the front desk checking her in all the way until the time of discharge. So everything in between. She said my staff were amazing. It's like nothing she'd ever experienced before. that the hospital looked like a little boutique and it was clean and she never wanted for anything. So that is how we get rewarded. And that's how we know that our leaders are feeling that empowerment and that they do have the resources to do their job.
Yeah, that's fantastic. So it sounds like the things that are keeping you up at night are sweet dreams and not necessarily nightmares, right? I mean, it sounds like you got a pretty good machine put together with your leadership and your physicians. So that's really good.
Absolutely. I'm very, very thankful for the team that I have, and they've done an amazing job.
Awesome. Very good. So, Stace, I'm going to ask you a similar question. You lead the San Antonio and Austin markets, and not everything is always as rosy as we would like it to be. We've got challenges that we encounter as leaders and as operators. So when we think about some of the challenges that, again, keep you up at night, what are some of those that you experience? And obviously, we can speak about a lot of the positive, but there are some challenges that we experience as well as leaders. So what are some of those things that keep you up at night, Stace?
Yeah, there's challenges with every business, but one of the things that really talking about, and I'm going to kind of use, because we have all different kinds of centers, from centers that are de novo centers that we're just opening, or centers that have been around for a while that really we're just trying to add volume to and grow. Yeah. But let's talk about new centers. One of the real challenges with new centers is we get a physician group that a lot of times has come from a hospital setting, and so really trying to change physician behavior and expectations about moving to an ASC, and just the change from inpatient to outpatient, and educating them and helping them educate their patients on going home the same day, and just the change in culture, which we've seen in a hospital setting as well, where total joints don't stay overnight and they go home that day and they do great. And so that's one of the things when you really, you start a center and conceptually new partners think, hey, this is going to be great, we're going to do all this. And then when it comes time to actually schedule cases, they have a little apprehension about, oh man, I'm changing something that's worked for me for years. And how's that going to go? And, physicians, and especially orthopedists, they're very kind of superstitious. And if it works and it's not broken, why am I messing with it? So then they get a little cold feet at the beginning until they get going. And then once they get going, they realize, the efficiencies, and my patients were so happy they got to go home, and they have great results. But that initial kind of, change in culture, it's difficult. And when we're, running a business that is based on volume and bringing cases and them changing their behavior at the beginning, it can sometimes be rough until we get going and do get those changes with their behavior and the patient's expectations going into it.
Yeah, that makes a lot of sense. What other challenges or things that keep you up at night? You mentioned the facilities that are just ramping up.
Yeah, so the biggest thing then too is then if we provide excellent patient care, is actually getting paid from the payers on what we did. And so that's become bigger and harder process every day, it seems like. It's like we do everything we can, and then there's other obstacles that are brought to us that didn't think we were going to encounter in order. And then that lag time too between, again, when you open up a center, between when you do cases and then actually when you get paid for them, and trying to bridge that gap to keep the center running and your employees paid. So that's another thing that it's extremely difficult right when we start a new center.
Yeah, absolutely. Absolutely. No, I thank you for that, Stace. And I think that's a good segue into, really some of the trends that we're seeing, because payer reimbursement has been an issue since the onset of dealing with commercial payers, government payers, et cetera. But as we talk about macro trends in the industry, that's something that is always front and mind, front and center with us in regards to being paid fairly and being paid timely, right? So Brittani and Sam are both here in the studio with me. Sam leads business office, which is really tied to the front end of revenue cycle, ensuring that we have clean claims going out the door and getting paid timely. So what are you seeing in regards to trends in our space, both in the surgical hospital and the ASC space, that could be positive, could be negative, could be concerning?
Yeah, unfortunately not super positive, but there has been quite an increase in denials, anywhere from 5 to 15% just in the last year. Wow. Which has just made it that much more difficult for us to get paid, not only timely, but at all. Yeah. So I mean, having the right team in place, both on the clinical and revenue cycle side, whether it be your vendors and then also your clinical team, of being able to fight those denials and work on the appeals and get those out in a timely manner so we can get paid, is a super detailed process that I don't think many realize.
Yeah, I appreciate that. So how have you sort of navigated those challenges? I know you and Brittani partner really closely in the DFW market, but it's a sort of a multifaceted approach when it comes to getting paid timely and getting paid fairly.
Yes, absolutely. And I worked really close with Brittani and her team, and she can provide some more information on the front end from the case management as far as making sure that all of the clinical documentation is there the first go around, right? Because it's, when we actually receive a denial and realize at that point we're going to have to submit for an appeal and figure out why we did, received a denial in the first place. It's so much easier when we have the provided necessary information on the front end. And there's so much that goes into that, of making sure we have the correct authorization, and that we're working with the offices to obtain that information correctly the first time around. So many times we might have an authorization, but it's for different codes than what CPT codes than the procedure that was actually performed. Right. And there's a lot of work that goes into getting back with the office and having them obtain a new authorization for those CPT codes. And then just documenting the appeal letter and making sure that the necessary information is obtained in there. And Brittani's been working really closely with our clinical team to make sure that they are creating the correct appeals that's actually going to get us paid.
That's right. Excellent.
So,
excellent.
Yeah, it's a lot of work.
Sounds like it. Absolutely.
Yeah.
But I tell you, it's, as you mentioned, it takes a team to really be able to execute on this, and
it does.
The combination of the clinical, the revenue cycle, and the operations teams. It seems like we have a really good flow in the organization now, which is great.
We're getting there, for sure. It's a continued work in process.
Beautiful. So, Brittani, I'm going to ask you a similar question. You can segue off of Sam, or you can go in a different direction. But trends that you're seeing that are having an impact on our space, and then also maybe even what keeps you up at night too. Like, what's? Let's hear it from you.
Couple of things. Reimbursement obviously is one of them. Sam and I have worked really closely to create a clinical documentation interdisciplinary team with our physician, revenue cycle, billing, coding, clinicians, case management, like she said, medical necessity nurse. And I think having all of those team members together on a call, we're meeting, 2 to 3 times a week now. It allows for us to see where we're falling short or pulling things from the EMR. I think having outdated technology and then trying to get claims out faster is a huge concern. And so I think us working on that and trying to teach and educate and put processes in place to be able to effectively impact billing and coding and being able to get our reduced denials, obviously, is the goal. But I think that is one of my biggest things that keeps me up at night. That, and then, the nursing, the healthcare workforce really is another one.
Talk about that a lot, because I know specifically in this market of DFW, this is an issue across the country, but I've worked in California and other areas that are highly populated regions. But specifically in DFW, we're experiencing a nursing shortage and other provider shortage as well. Maybe talk about some of those challenges and how you've been able to navigate it.
Yeah, provider challenges. It's all across healthcare. I think there's a lot of provider and clinician burnout, and people, after the wake of COVID, people have chosen to go into different career paths. So a lot of them have left the healthcare field or decided to do something different. And so when you look at even your big healthcare systems, here we have, Med City, we have Presby, and looking at those and talking to their leadership teams, they're having to close multiple ORs because, they don't even have enough staff. We're really partnering with staffing agencies because a lot of nurses have went to staffing agencies. They want to have flexibility. I will tell you when I'm going to work is, so having a good agency that you can work with and that's reliable and dependable whenever you need it is key. And then also it's really about, your culture at work, because people want to come somewhere where they feel engaged, they feel alignment, they have a purpose, they have a reason to be there. And I think that is listed almost higher on all statistics now than getting paid. Everybody wants to make money, but they want to go in and work for someone that they feel cared for, right? I think, and so that's a huge thing for us as an organization. And, Sam and I we've worked with you to say, and Kaylee, all of our team members to say, we really want that engagement with our staff. We want them to know that they're cared for. And, our turnover rates, if you look across our system, are very low. I think that we do a very good job of keeping our staff and having alignment with them, but it's also about holding physicians accountable and having alignment with your physicians as well.
That's right. Excellent. I liked how you talked about the culture there and how we're trying to drive that culture and the cultural change. We talked about that on a number of podcasts, but it's so critical in retention of people, right? It's one thing to get the staff members in the door, but you actually want to keep them in the door and have them engaged and have a good positive attitude. So I appreciate that. Really good perspectives from each of you. We talked about a lot of the challenges, but as leaders, we really all feel like we're in the right space. We're providing patients care in the right site of care, right? Where they can get them home the same day, great outcomes, great experience. What are we optimistic about in this space? And I open that up to whomever sort of wants to jump in on this topic, but I think there's a lot of optimism still in our industry, a lot of excitement, a lot of momentum. What sort of keeps you motivated and engaged and really happy to be working in the short stay surgical space? Stace, I'll start with you, actually. I'm just going to call you out. What kind of keeps you motivated?
I think, just the growth opportunities with the new areas and most physicians looking to go to an ASC to have, more control of their lives and schedules and not be dictated to like in a big hospital environment. So that's really fun. A growing business like we have right now is fun to be a part of, kind of at the semi-ground level. And so that's one of the really big rewarding things that I like at where we're at is that, we're opening up new markets, new cities, new partners, and it's exciting.
Yeah, good. Kathy, how about you?
Yeah, I agree with Stace. Watching our growth of Legent Health and watching new surgery centers come up, and like Stace said, physicians are really excited about being a part of those things, to have more control over their lives, but also, the staff that we have, the care that they show, the loyalty they have to the patients, to the physicians, to the center. And I stand behind the fact that we're giving the same quality of care as you would get in one of the big hospitals. Our staff are engaged, they're excited, they're experienced. And so I love to see the outcomes. And just like I said, my Google review that I mentioned earlier, to hear someone talk about us in that manner where everything was perfect, and they had a great stay, that's the reward as a nurse, as a leader. That's the best reward I could get.
Yeah, I love that. Awesome. How about you, Sam?
Yeah, I think at the end of the day, healthcare can't go away. Patients are going to continue to need treatment. They're going to need surgeries. And I think being in this space, especially within a smaller system, we have so much control of the patient experience and what their outcomes are going to be. And I think it's cool to see how that's going to evolve, especially over the next couple years and where Legent is today. That we get to control that whole experience and what we can do to improve, continue to improve on that.
Yeah, that's a great point. Brittani, how about you?
I'll be personal for just a moment.
Okay.
My grandmother had breast cancer twice, and She had, with her first surgery, she had a health care acquired infection. It was really, really horrible. But I think, I see DEEP flaps done in our facilities every week, and we take great care of these patients, and they have great outcomes. So for me, really, the whole reason I became a nurse was to help people, and seeing our quality metrics, what we're doing, our doctors that we're partnered with, we have quality physicians, we have quality staff, we want to do the right thing. And I know if my grandmother would have come to one of our facilities, she wouldn't have had that infection. So I think, that's what keeps me going here.
Well, I want to thank you all four of you, for joining this podcast. It's really important to hear from the folks who are actually driving the results in the organization, to hear you speak about your challenges. We're all human. We have good days and bad days, but the excitement that you all have is still there. The sort of a purity to hearing you guys speak about why you're engaged here, why you're still motivated. And to our audience, whether you're a member of the Legent Care team or you're in the external audience, we try to lead by example in our leadership team. I think when I visit the facilities, to hear from you all about the caring nature that our leaders provide, these four individuals and others as well, it's really rewarding to hear that we have built such a phenomenal team. So really, we're going to wrap it up with that. It's really good to hear the challenges of our leaders, to hear the positives, to hear about some of the trends going on in the industry, and we welcome feedback from you all. From our we've got this podcast is up on YouTube and other different forums. We'd love to hear from you guys, the different comments that you have about this topic, about other topics, and other topics that you might want to hear us address. I'd heard previously from some that they wanted us to do a deep dive on revenue cycle, You heard some of that from Sam today, but we're going to have another session coming up soon on revenue cycle, doing a real deep dive on the challenges and different strategies to navigate the payer landscape. So more to come on some of the bones and muscles of our organization, as we like to call this podcast. But until then, I'd like to thank you all for your time and attention. And again, thank you to this leadership team for joining the podcast. Appreciate you guys' time. And I wish you all have a great day. Thank you.
Thank you for listening to Beyond Bones and Muscles, a Legent Health podcast. We want to hear from you. Subscribe and leave us a rating. Your feedback helps improve our show. For more information about Legent Health, go to legenthealthservices.com.